Good morning. Today's class is on ANTHELMINTHIC drugs. At the end of this class, you will be able to name some of the most widely used ANTHELMINTHIC drugs, describe the mechanism of action of the important ANTHELMINTHIC drugs, describe their adverse effects and uses. ANTHELMINTHIC drugs are those drugs which are used to eradicate or reduce the number of helminthic parasites in the body. They may either kill the worm when they are called vermicidal drugs, or they may paralyze the worm and help to expel it from the gastrointestinal tract. Such drugs are called vermifuges or vermifugal drugs. Now these are some of the names of the worms which are clinically important. The roundworms, which come under the family nematodes, includes roundworm, whipworm, pinworm, threadworm, hookworm, etc., including the worms which cause filariasis. Then we have the tapeworms, the pork tapeworm, the beef tapeworm, fish tapeworm, Echinococcus granulosus, and then we have the flukes, blood fluke and liver fluke. Now there is no classification as such for the anthelminthic drugs. Based on the chemistry, we have a few groups. The most widely used ones are the benzimidazoles. This group includes mebendazole, albendazole, and thiabendazole. The most widely used is albendazole. Mebendazole is one of the earliest anthelminthic drugs which came into clinical use. It is a broad spectrum anthelminthic, meaning it is effective against a wide variety of worms. The mechanism of action of mebendazole is it binds to the beta-tubulin monomer of the worm mussel, blocks glucose uptake in the parasite, causing depletion or reduction of glycogen stores in the worm, and finally kills the worm. So mebendazole is vermicidal. In addition, mebendazole also kills the eggs and larvae. Common adverse effects encountered with mebendazole are diarrhea, nausea, abdominal pain, and hair loss or alopecia. Mebendazole is used in the treatment of roundworm, hookworm, and trichuris, where the dose is 100 milligrams tablet twice a day for 3 days. For enterobiosis, it is 100 milligrams single dose with a repeat of the same dose after 2 or 3 weeks. For Trichinella spiralis, it is 200 milligrams twice a day for 4 days. For hydatid disease, the dose is higher and the duration is longer, up to 400 milligrams 3 times a day for up to 1 month. It is also used in mixed worm infestation. So the commonly prescribed dose of mebendazole is 100 milligrams twice a day for 3 days. Albendazole is chemically related to mebendazole. So the mechanism of action is similar, that is binding to beta-tubulin, blocking glucose uptake, depletion of glycogen stores. Thus it is vermicidal and also kills the larvae and eggs. The active form of mebendazole, that is albendazole sulfoxide, is the one which kills the worms. Albendazole offers several advantages over mebendazole, and those advantages are: it is better tolerated, that is the gastrointestinal adverse effects are less, is effective in a single dose, superior to mebendazole in the treatment of hookworm, threadworm, hydatid disease and neurocysticercosis, also effective against Trichomonas, Giardia and Butyraria bancroftyi, and the active metabolite achieves higher concentrations when compared to mebendazole. Coming to the uses of mebendazole, it is a broad spectrum anthelminthic, so used for roundworm, hookworm, enterobius and trichuris trichura, where it is the drug of choice, and the dose is a 400 milligram single dose. The patient is instructed to chew the tablet and swallow just after dinner. The reason for chewing the tablet is the tablet is powdered in the mouth of the patient, so the surface area increases. For tapeworm, trichinella and strongyloids, the dose is 400 milligrams once daily for 3 days. Again, at bedtime, chew the tablet and swallow. For hydatid disease, the duration of treatment is for 4 weeks and twice a day 400 milligrams. Albendazole is also used as an add-on or adjuvant for filariasis along with diethylcarbamazine and ivermectin. For neurocysticercosis, the dose of albendazole is 15 milligrams per kg body weight per day for 1 month. Adverse effects are very similar to mebendazole but of a lesser intensity, that is nausea, vomiting, abdominal pain, dizziness, headache, fever, alopecia and jaundice. Diethylcarbamazine citrate, also called DEC, was the drug of choice for filariasis but now has been replaced by ivermectin. Now since this is a frequently asked 5-mark question, we will describe it. The mechanism of action of diethylcarbamazine is it alters the membrane of the parasite, making it susceptible to be phagocytosed by the monocytes of the host. So by itself, diethylcarbamazine does not kill the worm. It alters the membrane parasite, making it susceptible to be eaten up or swallowed by the host monocytes. And it also causes hyperpolarization of the worm muscle, paralyzing it, making it easy for phagocytosis. Diethylcarbamazine is used in filariasis where the dose is 2 milligrams per kg per day, 3 times a day. It is also used in tropical eosinophilia and loa and Onchocerca volvulus. That is, it's also called river blindness. But as of today, ivermectin is the drug of choice for river blindness. Adverse effects of diethylcarbamazine include nausea, loss of appetite, headache and dizziness. And in some patients, the Mazzotti reaction is experienced, that is rash, pruritus, fever, hypotension, enlargement of lymph nodes. Now this Mazzotti reaction is similar to the Jarisch-Herxheimer reaction which was seen in secondary syphilis when treated with penicillin. This is due to the release of lytic or breakdown products of the microfilaria and the adult worms. Praziquantel, very rarely used, just for completion's sake we will mention it. The mechanism of action of praziquantel is it causes leakage of calcium from intracellular stores. The muscles of the worm go into a spasm and results in spastic paralysis. So the worms and the encysted larvae are also killed. Adverse effects: bitter taste, nausea, vomiting, diarrhea, fever, skin rash and body ache. Praziquantel is used for treatment of tapeworm, neurocysticercosis, schistosomiasis and other flukes except Fasciola hepatica. Ivermectin is again a 5-mark question because it is the drug of choice in filariasis. Mechanism of action of ivermectin is it blocks the glutamate-gated chloride channels in invertebrates. So the worms develop tonic paralysis, that is the tone increases and the worm is paralyzed. Ivermectin is not effective against flukes and tapeworms. Ivermectin, coming to the uses. Onchocerciasis, that is liver blindness, ivermectin is the drug of choice. Strongyloidosis, filariasis, again drug of choice. Ascariasis, scabies and pediculosis. Adverse effects of ivermectin are very negligible, that is in the form of nausea, constipation, abdominal pain, itching and lethargy. The dose of ivermectin is 10 to 15 milligrams tablet per oral single dose. Ivermectin is a part of the WHO river blindness control program, like we mentioned, river blindness or Onchocerca volvulus. Now in some patients what happens is the worm gets into the eye, causing blindness. Niclosamide was the earlier drug of choice for tapeworm infestations but has now been replaced by albendazole. Niclosamide acts by inhibiting oxidative phosphorylation and ATP generation in the tapeworm mitochondria, especially in the scolex. The injured worm is partly digested. So what happens now? The segments of the worm which have the eggs, they can get broken. The eggs are released within the gastrointestinal tract of the host and can cause cysticercosis. To prevent the risk of cysticercosis, immediately after niclosamide, a purgative is given to expel the partly digested worm and the gravid segments. So that is the reason to give a purge or a saline purgative after treatment with niclosamide. The dose of niclosamide is 1 gram per oral after a light breakfast, followed by 1 gram after 1 hour. It is important to search for the scolex of the tapeworm in the stools to confirm that niclosamide has worked. The frequently appearing questions from this topic are 5-mark questions: albendazole, mebendazole, ivermectin and diethyl carbamazine. The 3-mark questions are: why is purgation or a purgative required after niclosamide therapy? This is to ensure that the gravid segments of the tapeworm do not break and release the eggs in the GIT. Therefore, the risk of cysticercosis is eliminated. Ocular onchocerciasis should not be treated. Like we said, in river blindness, the worm is in the eye. If the worm is killed in the eye, the breakdown products of the worm can cause a very severe inflammatory reaction resulting in blindness. That is one of the explanations for why ocular onchocerciasis should not be treated. But then there are some authorities who believe that ocular onchocerciasis can be treated and the inflammatory reaction can be suppressed by giving high dose of corticosteroids. Thank you.